It's amazing how much we're capable of doing using robotics. One of the most incredible things is surgery. While some people may think that robotic surgery is dangerous, it actually is safer than a human performing the surgery. You may be asking yourself why. That's because we have the power to program robots to do anything. Currently, robotic surgeries are controlled by a human surgeon from a different room. Hopefully, one day, these robots will be made with the intelligence to perform surgery without human assistance. More and more things can become possible as we continue to work on robotic surgeries. Robotic surgery is a type of minimally invasive surgery. Minimally invasive means that instead of operating on patients through large incisions, we use miniaturized surgical instruments that fit through a series of quarter-inch incisions. In other words, smaller cuts are made with robotics and they can fit and fix more without having to cut a greater amount of skin. Steve, one of the surgeons, notes, "It's as if I've miniaturized my body and gone inside the patient. It's so incredible the way these robots work." The Da Vinci is the world's greatest robotic tool for performing surgeries. The way this machine works is it has 4 claws. 3 of them have miniaturized tools and the 4th has a 3D camera. The 3D camera allows the surgeon to see what he's doing from miles away. It helps the surgeon by giving him or her a more 3D image of what's going on. The way the surgeon uses this machine is by putting his or her fingers in the master controls, which can operate all 4 claws simultaneously while looking at a high-definition monitor. The surgeon can set the settings to whatever he wants. If he sets it to a 3-to-1 scale, the Da Vinci will only move 1 inch every 3 inches the surgeon moves his or her fingers. Since robotic surgery is minimally invasive, patients experience a number of benefits compared to an open surgery, such as having fewer scars on their body, which means that the scars will heal sooner, allowing the patient to go back to his or her normal life faster. The first robot that ever performed surgery was the Puma 560. As much as we wish to program robots to do the entire surgery without human assistance, that wouldn't be possible. We would still need minor activity from the surgeon to have the perfect surgery. We've done so much with robotics in the past 20 years, and that's incredible. Robotics in surgery from when it first started has improved so much, and hopefully it continues to improve, so that eventually robots will be capable of performing surgeries with minor help from surgeons.
There are many different ways of masking pain, but one of the most difficult is masking the pain from a child. That is until a robot named Mikey was introduced. His purpose is to mask the pain from children by playing with them and asking what types of movies do they like and stuff like that. The children apparently don't feel either as much pain or no pain at all when getting the vaccine with the robot Mikey by their side the whole way through. The robot Mikey is exactly 23 inches tall. It has sensors on its head and on its stomach, which is the inertial sensor. The robot itself can do Tai Chi. Mikey even has a communication sensor so it knows when someone else is talking to it. All of these examples are on a YouTube video of Mikey doing his own thing. Even when Mikey gets knocked over or falls, it can get up itself without using any help. This piece of technology is very helpful because it helps little children get their vaccines even if children normally do. Mikey makes it way easier by masking the pain for them. I believe that it is a great place of technology because it's impressive and the robot can do everything by themselves and how far we've come with everything. For example, Mikey, look how much it can do by itself. It can get itself up, do Tai Chi, and a bunch of other things, etc.
Hello.
Hello now.
Wow, what is that thing lying on the ground? Hello now 75. Hello now 41. Have you seen my Roberta? I don't know, I am sorry.
Ouch! Sorry.
I am okay. I suppose I should get up. That's better. Goodbye. See you soon.
This is MEDI, which stands for Medicine and Engineering Designing Intelligence. The highly interactive childlike robot has the potential to comfort young patients during medical procedures and make their pain more tolerable.
Research suggests that 50% of children have severe anxiety and fear when it comes to needles. And so we know that negative feelings about medical procedures in childhood might linger well into adulthood. We know that these children, as adults, are unlikely to access healthcare services when they're experiencing health problems. So we wanted to look for an innovative, different kind of a way to see if we can better distract children during medical procedures like flu vaccination.
Today's technology has progressed and changed drastically over the last 20 years. From drones for military use to vacuum cleaners, robotics are becoming more common than ever. One area of drastically changed by advanced robotics technology is in the medical field. Robotics are now becoming used for accurately monitoring patients and dispensing medications. Although it may seem ridiculous to some people, the future is here. For example, if you were to be out at sea and you were to be severely injured, the robotic instrument could save your life. Not everyone is in the fact that a machine can perform such a huge surgery, although we rely on it every day. In 2000, the Da Vinci surgical system broke new ground by becoming the first robotic surgery system approved by the FDA. The Da Vinci system is one of the latest instruments for surgical procedures. Here's how it works. Small incisions are made to insert medical instruments in a high-definition 3D camera. While the surgeon is at the Da Vinci Council, our surgeon reviews and magnifies high-resolution 3D images of the surgical site inside your body. At the same time, the latest robotic and computer technologies scale, filter, scan, and translate your surgeon's hand movements into precise micro movements of the Da Vinci system. Instruments. Although it is often called a robot, the Da Vinci system can move or operate on its own. Your surgeon is 100% in control. To relieve the fear of many, robotic technology operating on humans is scientifically proven to be more efficient and safe than doctors because humans are more prone to mistakes, while the technology available today is more precise, less life-threatening, and loss of blood is minimized. The patient will also have a quicker recovery and a higher chance of surviving surgery. Within the topic I research, I have learned so much about the modern technology of robotic machines, most importantly, the Da Vinci system, and that I have come to realize that it is only the beginning of a new era. Today's technology is changing faster than we can think. With the use of this modern technology, we can save lives and build a bigger and better future. To learn more about the Da Vinci surgical system, go to www.intuitivesurgical.com.
My name is Jose Radilla. My subject is robots help doctors in surgeries. Robots help doctors make this world safe. One way they made it safe is by helping in hospitals. Robots will help with anything that doctors need help with. Some doctors are afraid that they might do something wrong, so they they use robots to like help them in surgeries. Robots will help with them in surgeries. Some robots won't help with surgeries. They will bring like tools or give air to the person to keep them alive. Some people think this is weird, but other people think that the robots will actually help with us. Robots are machines that they don't feel pain. They don't feel. They don't have feelings for things. They are just careful with their jobs and helping people with surgeries or whatever they need help with in the hospital. Robots. Some robots are are not helping with surgeries or bringing tools. Robots are just going to to want to see if they're still alive and see their blood pressure or just scan them to see if they're okay. Robots had the the Da Vinci has robots that help with surgeries and had the greatest robots that do their best job work in the job. It's so awesome how people use robots in so many things, just like in surgeries, and people use it for cars and other amazing things that people have. Robots are not the most intelligent machines. However, ever ever have different feelings from us, the people. Robots have better hands than us. We shake in surgeries, and robots don't shake as much as we us. When some robots open the some doctors open a person's body, they have to support the smell and the blood that people have inside. The inside of the body, how it looks like. The people have to support how it looks like inside the body. Robots don't have problems to open the person's body. They just open it up like it was a can. Robots don't have smell sensors, so that means they are qualified for the job. Robot have Robots have some weaknesses. Their weakness is harming the person's body and doing something wrong in it. Robots are getting control. Some robots are getting control from the other side of the room, and people are controlling them not to do anything wrong. Some robots are not controlled. They have long cords that they use in the room so that robots stay in the room of the hospital and no one steals them. When patients come in the room, they think that a person is going to attend them, but they see a robot just standing there, and they call a person to see why is there a robot just standing there and looking at them and not saying anything. The doctors say that the nurses say that it helps people with to see what do they have wrong in their body. So they have the Da Vinci system robots have 3D robots that can scan people's body and see that what do they need for their bodies and see what kind of medicine or treatment do they need or what kind of surgery. Robots are the most half half of the robots are most intelligent than people. Robots are made by people, not by other robots.
Advances in technology is amazing. Example, robotics in medicine are providing personal home care and even diagnosing medical conditions. The impact robotics will have on our health industry as a whole is increasing dramatically. So much so that they have entered the specialized and previously people-controlled field of surgery. Robotic surgery has introduced its surgeon robot called Da Vinci Surgical System. It arrived at Jupiter Medical Care Center, which last month was the first hospital in Florida to perform surgery with the Da Vinci system. Approved by the administration, FDA, in 2000, it is designed to complex surgery using a minimally invasive approach and is controlled by a surgeon from a console. This robot that cost the hospital $12 million helps doctors in hard-reach situations. It avoids overcutting when taking out cancerous lung tissue and can slickly remove a tumor from the uterus, all while leaving behind tiny incisions and causing minor blood loss. If you think about it, surgery can get done so much cleaner and faster with no critical incisions. Robots like this can be a huge positive impact on our medical field. Without them and how much they've improved over time, would you like to have a robot perform your surgery today?
The Da Vinci Surgical System is the most advanced platform for minimally invasive surgery available in the world today. The integration of high-resolution 3D vision, wristed instruments, and intuitive motion control enable the Da Vinci surgeon to transcend the limitations of conventional surgical technologies.
Here we are not to develop a big machinery to replace the surgeons, but to develop the smart instruments to be safer, more consistent, the outcome for the patient that is better.
For former kindergarten teacher Mary Brown, the decision to get a hysterectomy was a little less overwhelming than it could have been.
Said 3 little, like pencil-size incisions, and the robot goes in there and snip, snip, snip. You're all done and heal faster, so I said, let's do it.
Mary is the first patient in the Valley to have a robotic-assisted surgery done by the Da Vinci Xi. Doctors say it's the most technologically advanced model yet.
You know, it may seem pretty big and large, but compared to the other robots, this is actually very compact.
Located at West Valley Hospital, the Da Vinci Xi is a robot that makes surgeries minimally invasive, which translates to less time in the hospital for patients.
You can imagine the cost versus somebody staying an additional day or 2, but more importantly is that the complication rates are very minimal.
The robot has 4 arms, and a camera can be attached to any of them. The zoom is so precise that in this test we were able to see a little Lincoln in his memorial on the back of a penny. But even with high-tech instruments like this, there is no replacing a skilled surgeon.
No matter how advanced we get in technologies, medicine is still an art and a science.
The art is how hospital staff treat patients like Mary and get her home faster.
So I'm just anxious to get home and get caught up for the couple days that I'm missing here. So.